Council of Canada released its 2011 progress report, and the conclusions are very clear. This government failed to make progress because they failed to show leadership. Conservatives stalled altogether on a cost-saving national prescription drug program, failing Canadians who are now facing extraordinary drug costs. Will this government acknowledge their lack of progress and commit to working with New Democrats to protect Canada's healthcare system?
Thank you, Mr. Speaker. Mr. Speaker, and I look forward to working with my colleague for the next 4 years. Our government recognizes the importance of timely access to health care and is working to support the provinces and the territories in their efforts to address the issues of wait time. As an example, we have increased the transfers to the provinces by over 33% since we formed government, and we will continue so that the provinces and territories can continue to focus in areas of importance, and will work collaboratively with the provinces and territories to renew the health care accord and to continue to reduce wait times in the respective jurisdictions. Thank you, Mr. Speaker.
The honourable member for Vancouver East.
Well, Mr. Speaker, health care is far too important for just empty rhetoric, and Canadians are very tired of false promises. Leading into the 2014 health care negotiations, now is the time to bring in much-needed improvements. So, Mr. Speaker, will the government commit to holding open consultations with Canadians so that the next accord reflects their values and priorities for healthcare in this country?
Thank you, Mr. Speaker. Mr. Speaker, like I said before, we're looking forward to working with the provinces and territories to renew the health accord and to continue to address the areas of wait time as an example, while respecting the fact that the health care is delivered by the provinces and jurisdictions. Our discussions will emphasize the importance of accountability and results for Canadians, including better reporting from the provinces and the territories to measure progress and guarantees covering additional medically necessary procedures. Thank you, Mr. Speaker.
Mr. Speaker, millions of Canadians have to get by without medical care that they need because they don't have a family doctor. This means more and more families are turning to emergency rooms just for primary care. Not only is this hurting the health of Canadians, it also increases the pressure on emergency rooms and costs millions more for everyone. Mr. Speaker, will this government finally agree to work with the provinces and the territories to hire more healthcare professionals?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, as the member is well aware, the health accord expires on 2014, and not this year, and not next year, and not the year after. In the meantime, our government will continue to work with the provinces and the territories on the present accord and priorities identified, such as encouraging the statutory review of the accord in both the Senate and the House, as well as to be supportive of the provinces and territories in the reduction of wait times. We have also gained a lot of grounds on establishing electronic health records, a number of other initiatives. Thank you, Mr. Speaker.
Honourable member for Vancouver East.
Mr. Speaker, after 7 years of that health code, none of that is translated into doctors for Canadian families. The Conservatives had a second chance to address this in this budget, but incredibly, they let it go. The fact is, Canada needs thousands of new doctors and nurses stat, and the provinces are looking to the federal government to help solve this. So again, Mr. Speaker, will the government work with us to improve these frontline services so that Canadian families get the health care that they need and deserve?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, our government supports the efforts of the provinces and territories to effectively manage their health care providers so that they are adequate numbers of medical practitioners are available to their residents. While physicians and nurses supply is a provincial and territorial responsibility, our government has increased healthcare transfers to the provinces and territories by more than 33% since we formed government. As well, I recently announced the federal funding to support more than 100 family medicine residents to receive training, and provinces provide medical services to remote and rural communities.
The Honourable Deputy.
The Honourable Member for
Vancouver East.
Oh, thank you, Mr. Speaker. Well, Mr. Speaker, if the Minister is so proud of her work on HIV/AIDS, then why is she hiding from this major meeting. This international gathering is about the future of the fight against HIV/AIDS, but the Minister has effectively removed Canada from any leading role fighting this global epidemic. So, Mr. Speaker, I'd like to ask this. If the Prime Minister can find time in his schedule to fly to Boston to watch a hockey game, surely this Minister can find the time to go to New York to help fight AIDS.
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, as I said before, Canada is world leader in establishing the HIV vaccine initiative globally in partnership with Belinda and Gates Foundation. This is not just with Canada, but along with many other countries are involved in the same project. In addition, Mr. Speaker, last year alone, our government provided $42 million in HIV/AIDS research funding through the Canadian Institute of Health Research, which partners with not just Canadian researchers, but also the global community. Thank you, Mr. Speaker.
Is well aware that children in Canada are at risk to the improper use of medications because Health Canada doesn't require drug companies to disclose information on the effects on children. It seems astounding that Health Canada would allow this to happen. Mr. Speaker, drug safety is of huge public concern. So why is this minister not aggressively protecting the health of children and all Canadians with strict regulations for drug safety?
And the Honourable Parliamentary Secretary, Minister of Health.
Thank you very much, Mr. Speaker, and I want to thank the member for her question. And I want to assure her and all Canadians that we have one of the safest drug approval systems in the world. We have made significant investments in the Drug Safety and Effectiveness Network. As well, our government also created MedEffect Canada, a one-stop resource for health product safety information and adverse reaction reporting. Thank you very much, Mr. Speaker.
The Honourable Member for Vancouver
Mr.
East.
Speaker, I think the Parliamentary Secretary should get up to speed because the Canadian Medical Association General certainly doesn't seem to think that this government has addressed this issue in any adequate way. In both the US and Europe, regulatory and legislative changes ensure drug testing and disclosure on the effects of medications to children, but Canada lags far, far behind. Will the Minister commit today to regulations that require full disclosure from drug companies so that children are not at risk when they're taking their medications?
The Honourable Parliamentary Secretary.
Mr. Speaker, I can assure that member and Canadians that we are up to speed. We encourage manufacturers to submit pediatric information and introduce an additional 6-month data protection for drugs if they are filed for pediatric indication. In addition, Mr. Speaker, our government created an independent pediatric expert advisory committee to provide advice on the development, licensing, and vigilance of products. Thank you very much.
The member for Mississauga, Streetsville. Honourable Member for Vancouver East.
Well, Mr. Speaker, back-to-work legislation is an unjustified interference with the rights of workers to free collective bargaining, and the government's failure to address the pensions crisis is what's really at stake here. The fact is the Conservatives are choosing a side. They are strengthening the position of large employers who want to dismantle defined benefit pension plans. So why is the Labour Minister siding with dismantlement of pensions?
I'd just like to begin by indicating that the honourable member's characterization of labour law in Canada is completely incorrect. Secondly, Mr. Speaker, I think it's important to note that there are no sides being taken in any kind of legislation that may be put before the House, and indeed the side that we're on is the side of the economy, the side of general Canadian interest, because we want these parties to do a deal, and if they can't do a deal, we'll help them in the process to do so with the least amount of damage to the Canadian public.
The Honourable Member for Vancouver East.
Well, you know, Mr. Speaker, labour rights do exist in this country, and the government's approach to the current labour disputes reeks of hypocrisy. The government wants back-to-work legislation, denying workers the right to strike and undermining their capacity to bargain fairly. And in the case of Canada Post, it's a government agency that locked them out. How is that fair negotiation? So why is the government getting in the middle of a labour dispute and picking winners and losers?
country, we do have the right to collectively bargain, and it's the role of Labour Canada actually to help facilitate this collective bargaining process. In the case of both Air Canada and Canada Post, we've been diligently at the table providing conciliation, providing mediation. I've helped provide services as well, too, to both parties. We want them to reach their own deal. They haven't been able to, and we have to protect those who do not have a place at that table. That is our appropriate response as the government.
The honourable member for Toronto.